Welcome to On the Edge of Health and Design, the podcast where healthcare meets design, with your hosts, Nita and Sylvia.
Hi everyone. In this month's episode, we welcome Sajid, a colleague from Nita's Toastmaster Club. Toastmasters is a volunteer-led organization designed to improve communication and leadership skills. In this episode, we flip the script in that Sajid is interviewing your co-host Nita. Our conversation reveals my personal and professional journey with Toastmasters and how that intersects with my roles in healthcare as well as design and podcasting. We hope you enjoy this episode and take something away in your personal and professional journeys.
Hi, Nita. Good evening.
Hi, Sajid.
So today I have a few questions for you around our Toastmaster Club. So I'm going to start with question number one. So your career spans pharmacy, healthcare design, and podcasting. What inspired you to explore these different fields and how they have influenced your approach to communication and leadership overall?
Well, I'd say that pharmacy was not a lifelong dream. It was just a default career choice. I wanted to work in healthcare, but I didn't know what. And I think pharmacy, I was sort of influenced by my family to just go and see if I could get in. And once I get into something, I tend to follow through. So that's how that happened. And then healthcare design was a few years ago as a part of a midlife crisis. So I just felt like I wasn't going anywhere in terms of my career, and I wanted to do something maybe broader in healthcare. So I again explored different programs, and there was one called Design for Health at OCAD, and it was an experiment. Can I get into this program? And I did. So then I finished it. Like
Followed
this is
through.
what, yeah, I follow through. And then podcasting, that sort of came out of after I finished the program. I had a colleague that I was working with in the program, and we did a few projects together, and she's great to work with. And we tried our hand at starting a consultancy after we graduated, and that did not work out. And I always wanted to do a podcast, and so that's how we just decided to try podcasting instead. And that I'd say has worked out for the most part, at least from a personal fulfillment perspective.
And that definitely, help you with your overall communication skills, right? Which outside the Toastmaster Club got some of it got trickled down to the Toastmaster Club as well. Yeah.
Yeah, for sure. Yeah, Toastmasters, the approach to communication, the leadership skills that you build there, like I think it's really important in anything that you do, not just in career, but in life in general.
Yeah, 100%. Thank you. So over to our second question. How did you first get involved with Toastmasters and what impact has it on your career? Like particularly in high stakes healthcare settings, like patient counseling or like team presentations, or any other activities related to work?
Yeah, I first heard about Toastmasters, I think, as a child. There was a friend of the family who wanted me to do it because he was in Toastmasters. And I was super shy and obviously hated public speaking or public attention of any kind, and was very resistant to this up until maybe I think over 10 years ago was the first time I joined. And I tried a few different clubs, and then I settled on Go-Getters just because Go-Getters seemed a little bit more chill. And it the members over the years tend to have a really good sense of humor, and that is definitely super attractive to me in many contexts, either work or personally. And so that's what attracted me to Toastmasters, was the ability to kind of get together with a like-minded group and work on communication, but at the same time keep it sort of light and funny at times. And so that's how I got involved in Toastmasters. And as I said before, like the impact on career and personally, it just makes you more comfortable with being uncomfortable, with that feeling of being in front of others and presenting. When I was in grad school, I was always the person to volunteer to present on behalf of our teams. We had to do a lot of presentations, and I hate presenting. I still hate presenting. It's that feeling is never going to go away, but Toastmasters just makes it a little more bearable. Like you just learn to accept that you're going to be uncomfortable, and maybe you don't have to appear uncomfortable. You can just appear like you're calm and you're having a great time and you're cracking jokes or whatever. And but inside you're freaking out, of course, but you just accept it in the end.
Yeah,
Yeah.
you feel you're uncomfortable underneath, but you are able to maintain your composure better, I would say. And
Yeah.
I've seen you like since I've been with the club for the last 1 year, and I've seen your countless speeches, and all of them were so phenomenal. Even when the table topic wasn't that great, and you nailed it every time. And like I can see the like your answer at play, like literally, like
Oh,
here.
thank you.
Mm.
Because impromptu speaking, like being put on the spot, asked a question, coming up with a organized answer, it's an
It's
invaluable,
challenging.
right? Like
Yeah,
it
yeah,
you use it in interviews, you use it in personal interactions. You talked about patient counseling, which I do as a pharmacist, and all of those things involve impromptu speaking because people are going to put you on the spot. They're going to ask you a question, you have no idea how to answer, but you have to address it in a way that's going to be acceptable to them, or you have to
yeah,
tell them, I don't know, but I'm going to look this up for you, and I'm going to come back to you, right?
yeah. No, it's an invaluable skill. I agree with you. Over to our third question. So, as a co-host of On the Edge of Health and Design, what have been some of your most insightful conversations, and has Toastmasters helped you to become like a better interviewer in any way? Yeah.
On the Edge of Health and Design, that is the name of my podcast. We recently rebranded, and we think this name kind of talks about the intersection of health and design a lot more than the previous name, which I won't name because we don't want to be known by that previous name. Yeah, it has helped me be a better interviewer. I think whatever it is, you need to actually listen and pay attention during the meetings. And I think that's really helpful when you're interviewing, especially when you're interviewing around healthcare topics, which can be very emotional. So the two episodes that I would say, the two guests that I've interviewed where it's a very emotional and personal story. Those are kind of the ones that stick out to me. Those are the ones that are hard on me emotionally because I'm a very emotional person, and they're also hard to edit because you have to like listen to it again and again, right? And you're put in that emotional space again and again. But it brings you closer to the people that you're interviewing, and it brings you closer to their stories. So the one that I told in season 1, episode 8, was Viviana's story. She's a cancer patient, and her cancer journey kind of helped her go from being an architect in like sort of a high stakes, male dominated industry and transitioning to being an artist and being kind of her own boss and doing her own thing and tapping into her creativity. And that kind of really helped her recovery. And like I got to know her in that interview. I ended up visiting her in Montreal, like when she had her first art exhibit. So it's definitely a conversation that, I really connected with. And we actually did a follow-up interview with her as well. And then the other episode was kind of the past few months. In November, I interviewed a physician, Faisal, who had kind of a dual perspective as both a physician and a caregiver for his mom before she passed away. So again, it was kind of a very kind of emotional conversation. And I think involved a lot of editing because he was
And
remote.
listening to it again and again.
Yeah,
Yeah.
he was very far away. There's a big time difference, and it was sort of hard to edit and hard emotionally to like hear that stuff over and over again and try to
Mm,
craft the right story. So I think Toastmasters, like the listening for cues, knowing what questions to ask, like I think those skills are super
yeah.
valuable in telling any kind of story. It doesn't have to be in
Yeah.
podcast form, but it could be an article or
Yeah.
anything that you're creating with someone else.
Yeah. No, this is I'd say that this is very insightful. Like I'm a podcast listener myself, and like some stories they you can relate so bad, like stories, and yeah, it's really hard. I can imagine like when you're working on them, right? Like listen to that, and like you mentioned, like getting the storytelling right is what's gonna sell. So at the end of the day, yeah, it's a challenging task. For professionals in healthcare, what communication skills do you think are most crucial, and how can organizations like Toastmasters help develop them?
I'd say the number one thing in healthcare is empathy. Like we did a whole podcast episode on that, season 1, episode 5, empathy in healthcare. I think it's something that like you go into healthcare as a provider because you want to help people, right? And eventually you there's so many problems in healthcare that it sometimes sucks the empathy out of you and you end up like burnt out, and the pandemic compounded all of that, and there's a lot of
Yeah.
healthcare providers leaving the professions, like in pharmacy, in nursing, especially, even doctors, you name it, like in healthcare, there's not enough. There's never enough.
Hmm.
And it all sort of starts with empathy, but the empathy is, again, like it needs to be two-way. So you need to have empathy for patients and you need to be there for the patients and the families, and that's obviously very important, and you need to have great communication to do that. You need to build trust and rapport with these people, but the empathy also has to come to you from the system, the institutions that you work in, the the places where you provide this care. They need to care for you, right? Because if they don't care for you, you're not going to be able to care for those patients.
Yeah.
That the airline commercial that
This
everybody
whole
talks
chain.
about,
Yeah.
yeah, where you have to put the oxygen mask on first before you help someone else. That comes up a lot in healthcare speak. Yeah, give us oxygen so that we can give our patients oxygen.
Yeah.
Often missing in healthcare. The health and well-being of the provider is missing in healthcare, and that was a little healthcare rant. But how can Toastmasters help with this? It just goes back to the communication, the leadership skills, the empathy building through active listening. Sometimes the skills that they teach you around presenting is useful, even in my role right now, where I'm often called to provide education to the nurses, for example. Some of the skills that I remember from Toastmasters is not overwhelming people with information, right? Chunking information into like groups of 3 when you do a speech, keeping your slides like super simple because people are not going to take in all that information. The human brain can only take in like 5 to 7 pieces of information at a time. That's why phone numbers in the back in the day were only 7 digits.
Yeah.
So I think those types of things are important in getting your message across as clearly and succinctly as possible. So that's another very important thing in healthcare, clear communication.
Communication. Yeah.
Yeah.
And to add to that, one thing I would say, like empathy is a very interesting one because I feel like, like a lot of people in the Toastmaster Club, English is not their native language, right? And
Right.
you need to be kind and empathic there, like to understand what the person's struggle is. I think that's also a very something very important and crucial that I personally learned through Toastmasters because when I joined, I thought that everyone's going to be really good and I have to
Mhm.
compete. But like there are people from every stage of communication, and it's just
Yeah.
like supporting them for growth, like I think is very important.
Yeah, that's a really good point. The other important thing that Toastmasters gives you is a sense of community that you're never going to find out in the real world, or is very hard to find out in the real world. Like where you're talking about people accepting you and being kind to you, and we've we accept everyone. Yeah,
Yeah,
like it's just a given that we accept everyone who shows
yeah,
up to our meetings, no matter
yeah.
what kind of walk of life they came
Walk
from.
of life they're from. Yeah, yeah.
Yeah, and
I
they're
really
given
enjoy that.
opportunity to voice their opinion,
Express
right?
themselves.
Yeah.
Yeah,
So
I
that's
really enjoy that aspect
important.
of Toastmasters. So yeah.
Yeah.
Okay, last question. Looking ahead, what are your future goals, whether in Toastmasters, podcasting, or healthcare? What advice would you give to people looking to improve their communication skills?
In terms of my future plans, I avoid making future plans simply because
More in the moment.
yeah, like I think over the years I've thought about the future and I've had various visions of my future, and 100% of the time they haven't happened. So yeah, it's kind of risky for me to envision the future. I feel like I should just put an intention into the universe like I did lately for the
Manifest it.
yeah, for the
Yeah.
podcast, I just put sort of a general intention that I wanted to return to interviewing people because in our second season we kind of dabbled with doing educational type podcasts and
Hmm.
they didn't have a lot of engagement. So I just was like, I want to interview people. And then people started coming to be interviewed. I think I just noticed opportunities more.
Yeah.
And then our latest podcast was our first video one. And that happened because this person that we interviewed, his assistant, listened to one of our previous episodes, liked it, and recommended him for our podcast. The first time that happened to us. So maybe that sort of general intention approach is working at a hands off on the future and just kind of leaving it in the hands of the universe and just having
Yeah.
good intentions.
Thank you, Nita. Thank you for your time today.
Thank you for joining us on The Edge. If you enjoyed this episode, please share it with others or leave a comment or rating. Stay tuned for more episodes of On the Edge of Health and Design.